Bonjour, bienvenue dans Topik Konversasyon. Et aujourd'hui, bon matin, nous causons un petit peu de la beauté. Et quelque chose d'important, c'est tout pour madame, mais aussi pour monsieur qui paraît pour prendre cas avec votre décor. Après tout, il dit, si you look good, you can have good on the inside and on the outside, right? Aujourd'hui, we're going to talk to the man that can make you look really, really good on the outside and thus filtering it on the inside. So, mesdames et messieurs, on a un grand plaisir aujourd'hui bon matin pour être aux autres avec Dr. LICEA. Good morning, doctor. How are you?
Good morning. Very good, and thank you for the invitation.
It's an absolute pleasure meeting you. Et of course, on va aller, nous avons un monde qui pas nouveau l'oiseau Cécile, comme si nous avons dit, maman Lacou. Miss Penny, bonjour, comment ça va?
Bonjour, bien merci Sylvie.
Un plaisir pour avec vous. Et of course, aujourd'hui, par exemple, dit, sa Dr. LICEA, li est basé Victoria Aesthetic Clinic. Et nous pouvons un petit peu le service qui li offert les Yvonne Cécile. Par contre, obligé, mais tout apprêtement, obviously. Mais avant d'aller dans tout ça là, nous pouvons faire des actions par l'habitude. Now, nous commençons avec Dr. LICEA. How do you start your morning, doctor? Tea, coffee, water, and what time does doctor start his morning?
No, I'm not a tea person.
Okay.
And I don't drink milk either.
Okay.
In the morning, what I have eggs and some vegetables.
Eggs and vegetables. Mm-hmm. That's your breakfast.
That's my breakfast.
For drinking, what do you go for?
Water.
Only water.
Plain water.
Plain water. All right, and that's throughout the day.
Yes.
Do you have any coffee in between? No.
It depends on my mood.
If
Sometimes
it's a good day.
I have one.
Black coffee or milk and sugar?
Black coffee, plain, no sugar,
no sugar,
milk.
No milk. Okay. Doctor, born and raised, which country?
Born and raised in Cuba.
Born and raised in Cuba.
But now I live in Spain.
Now you live in Spain.
And most of my time as well, I'm living in Seychelles because I'm coming in and out.
Okay. All right. Okay. And in Cuba, from which part of Cuba you are? You know, because Seychelles is almost like Cuba, an island country. So which part of Cuba are you from?
I am from Havana.
Oh.
The main capital.
The good one, the good part. Okay, the party part? Because you can still see the old buildings, the old cars and everything, the Cadillacs and so forth. So do you miss home?
Not really.
Not really?
No, it's a pity because the situation in Cuba now is not really good.
Okay.
And
you prefer to be on the outside?
Yes.
Okay. Miss Penny, bonjour, encore une fois. Dites café de l'eau. Qui meilleur comment sur la journée? Quelle est comment sur la journée?
De l'eau, café. Après, n'importe.
Café noir, café diléditique?
Non, un petit latte ou bien un petit cappuccino. Bon matin,
okay.
Important ça.
C'est moi-même, oui. Important, oui. Miss Penny, né grandi, quel district?
En Sopin.
Oui.
Mon école en Sopin.
Oui.
Après, mon à Polytechnique, en Soya. Après, mon à l'université. Mon retourne Cécile. Oui, mais c'est bon, pas nécessaire.
OK. All right. So, aujourd'hui, bon matin, mesdames et messieurs, nous faisons aux actions. Et là, vraiment, nous pouvons faire une conversation. L'eau, ça va service. Now, doctor, you are a cosmetic surgeon, if you can correct me?
Yes, I am a general surgeon.
A general surgeon.
That's my education. But as well.
Yes.
But as well, I do cosmetic surgery and
yes.
as well aesthetic medicine.
Okay. And in your field of work, how many years you've been in practice?
Well, as a surgeon,
yeah.
I have been practicing for the last 25 years approximately.
Okay.
But I am mainly now focused on well-being and anti-aging.
Okay.
So that's what I love to do now.
What brought about the change, doctor?
I think I have to change to do that move in my career due to some technical consideration.
Okay.
It took me some time to validate my diplomas in Spain.
Okay.
So I have to do something different.
Yeah.
And then I got to know this. I went to do a master in aesthetic and anti-aging medicine.
Okay.
And that is my new passion.
And some people would say is it easier or more difficult working with women? Because I'm assuming, you correct me if I'm wrong, I'm assuming the majority of your clients are ladies.
90%.
90% are ladies. How easy is it to work with ladies? Because some men will be like, oh my goodness, these ladies, they don't know what they want, first of all. So how easy or how difficult is it working with the ladies?
For me, it is very easy, and I enjoy it. This is not work for me.
Okay.
So I am passionate about this.
Yeah.
But working with ladies is perfect.
Okay. At one point, if I may say, you're a bit like Picasso because it's an art, isn't it?
Definitely. It is
Yeah.
an art.
Okay.
When I see a woman, I just picture how I want to see her later.
Okay.
So that's what I focus, and then I try to get to that point.
Okay. All right. And what are the age? Because some people are very curious nowadays. The more information they have, the better choices they can make in terms of what they want as services from your clinic. Now, let's say, what are some of the age limits? Because some people really want to start very, very young. How young can we start? Which age is like, okay, you're too young now, don't?
Well, there is not an age limit really.
Okay.
Not when you are younger or when you are older.
Okay.
It depends. And what the point is that you will not qualify to all type of treatments.
Okay.
For instance, at a younger age, what we advise is a preventive treatment,
Okay.
just to moisturize well the skin, some protection. We may give some vitamins, just a preventive measure.
Okay.
At the later stage, then we need to add on the skin, on the
Yeah.
deep tissue, fillers,
Okay.
peelings. It depends on the age.
And in Seychelles, obviously, with the sun, I mean, you must witness a lot of damages that has happened to the skin. Perhaps we can start talking about some of the treatments that you are offering in terms of services.
Yes, the most important, due to the Seychelles climate, is
Yes.
sunblock. That's the most important. Basic. You have to wear a good sunblock even if you are indoors.
Okay.
Because we think that because we are indoor, we don't need it. Nowadays, we have a lot of lights,
Yeah.
computers, phones. All this will damage as well our skin. It's not only the sunlight.
Okay.
And apart from the sunblock,
Yeah.
the most important treatment that we can do are peelings.
Okay.
Just to change or remove the damaged skin,
Okay.
and to promote the growth of new skin,
But if-
healthier skin.
But this is something interesting I always wanted to ask, because I've heard this before. And my question is, if I'm at a certain age, for example, I am at 43 right now, and I do a peeling, how, the underneath that, some people say you get a baby skin, fresh skin, new skin. But because of my age, wouldn't my skin reflect the wrinkles for my age of 43? Or would I still be receiving the skin that I possibly had when I was 20 or 21?
Well, not 2021, but let's make it 25.
25, okay. That's still good enough, okay.
No. The point is that when you do peeling,
Yes,
you stimulate the lower layers of the skin
okay.
to produce new cells. You stimulate the stem cells, and
Okay.
then you will grow new cells. And
Okay.
definitely, yes, your skin is going to be younger, and it's going to be, look prettier and better.
How long does that last for?
Well, all treatments, they need maintenance.
Okay.
Because age is a continuous process. We do not stop aging, and the cells, skin cells as well, age, and there is a cycle.
Okay.
So what is advisable is to do a treatment,
Yeah.
and by the way, we recommend really in this type of climate, instead of doing one deep peeling, we recommend doing 3 sessions, medium
Okay.
deep. So the skin will recover in between sessions,
Okay.
and you can continue with your life.
Okay.
And as a maintenance, it is needed
Okay.
to do a refresh treatment probably once a year
Once a year.
to keep the results.
So you do 3 peeling, but in between you have to do the maintenance as well.
Definitely.
All right. Miss Penny, la ko dorme nous pose un petit peu en créole pour nous gagner comprendre bien même pour nous ban clients peut-être pour nécessité pour tel service. I mean, what's when madame, et what's when the monde qui prend cac et coule corps ou qui tout to the paille ou dit to the nines comme c'est causé. Yeah, à cause ça. Il peut y avoir des trends ou pas c'est ça, hein?
Yeah, Sylvie, on connaît wellness
Yes.
avec équipe nous l'école important.
Yeah.
Nous pas qu'à nous nous tombons malades, commence à complications, tension, diabète, par exemple, nous avons prevention.
Yeah.
Prevention is better than cure.
Yeah.
Mais côté victoire esthétique, nous préférons commencer un traitement et 10 moun avant de prendre le traitement.
Okay.
Par exemple, nous avons un bon weight loss programme qui nous aide à 10 moun qui ont des difficultés à perdre du poids.
Okay.
Et ça nous aide. Et nous avons nos techniciens qui aident nous dans le programme diet,
Yes.
l'exercice, tout ça là vient ensemble.
Ok.
So pour nous, un service qui nous décide à là-dedans, c'est pour donner back sa confiance qui dit moun y envie ou bien bonne madame, bonne monsieur aussi, hein, beaucoup monsieur y viennent hein.
Oui.
Pour autres pas satisfaire aux oli, mais seulement faire sentir en bonne santé,
Feeling
sentir
good
bien dans
about
la peau.
yourself.
Yes.
Feeling good in your skin.
Yes.
And that's important for a lot of people.
Yeah.
To get by in life because everything else could be crashing around them. But they look at themselves in the mirror and they look good, they feel good. To hell with what the world brings on.
Yeah. It's a
And
good
that need
feeling.
is not connected to age.
It's exactly.
Because I have patients that they are 60, 70,
Yeah.
even older.
Okay.
And they feel good and they feel more confident
All right.
when you treat them and they get just a bit better.
Yeah, it is important, isn't it? I mean, par nous dire wellness, il contient tout l'aspect de la vie et encore pareil, Miss Penny expliquait, il y a les autres composants qui viennent ensemble. I like how there is an incorporation of not just the cosmetic side, this cosmetic surgery, but there's also the wellness part of it that
Yes.
comes with the whole program. Now, what are some of the services that we do? I know we have a little bit of nip and tuck. Do we do that as well?
Yes.
No. How
Yes,
far do
we
we
do.
go with the services?
Everything.
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 What is everything? You're sounding like Christmas.
Yes.
And it just passed by. Allez, talk to me.
From les pifigis,
Oui.
LICEA, nous avons
Ok.
beaucoup de madame qui gagnent very hairy, ou bien qui ont envie Hollywood part, or all these things, nous faisons LICEA as well.
Ok.
Par exemple, nous avons une machine qui fait récher pour les corps,
Oui.
qui massage. Moi, je crois un jour qui est bon, nous faisons un petit programme, nous guettons en entier.
Oui.
Parce qu'il vient de différents quelque chose. Et aussi, mental health is very important pour nous.
Yeah.
Et nous avons un psychologue qui nous travaille avec. Par exemple, nous avons un zen qui a 13 ans, 14 ans, qui pèse 130 kilos, 140 kilos. Et pour nous, c'est not about 10 aides pour venir maigrir, mais nous besoin voir à cause. Et aider les gens change your habits as well.
Okay.
It's not only about aujourd'hui, vous faire ça, aujourd'hui, ou maigre, mais vous besoin sans vos habits. Et quoi que vous pouvez faire tous les jours, que vous besoin regretter avant ou continuer.
Now, we've got certain people asking about maybe a more upper scale surgery, tummy tucking, liposuction. Are these services that you are offering right now?
Yes, we are covering all those surgical services as well.
Okay.
In our location, we don't have a theater, but we have collaboration with other clinics.
Okay.
They have the facilities ready, so we just allocate time for them and we do the procedure. It can be done.
So this is something that you can offer your clients as well.
We are doing it
Yeah.
right now.
Yes. Yes, Penny.
And boobs as well.
Oh.
Yes.
But,
Not mine.
not well. No, yours is natural. She's what? I mean, I know a lot of ladies. They say after a while, gravity takes it, and the natural course of life. It goes down a little bit. Doctor, can you make them go a little bit higher? So this is filling
Definitely, we can do it. And the name of the procedure is a breast lift.
breast lift. Yes. Okay.
And we can do it safely. It is done with the IV sedation and local anesthesia.
Okay.
So we reduce the risk of general anesthesia.
Oh, all right. So how long does this take about?
The procedure, a
Yeah.
couple of hours.
A couple of hours.
Yes, and the patient will be able to go home same day.
Same day. And what about aftercare? How important are aftercare? Because a lot of people, they think it's just a procedure and then it's done. What about aftercare?
No, the aftercare is as important as the procedure
Okay.
because it depends on the aftercare, your results will vary. If you don't take good care, you can have developed scarring, infections.
Okay.
So it is important as well.
It's very important. Miss Penny, obviously, nous connaissons ou pour le côté pareil, ben la fait surgery. How comfortable or uncomfortable are you with these procedures?
On connaît, il donne sens à des gens qui ont envie sans son la vie.
Yeah.
Si sentit pour son tété trop gros, bientôt petit,
Yes.
il a envie à arranger. So nous là pour donner ça support et ça confort.
Yeah.
À part qui docteur LICEA, nous aussi on a des autres docteurs qui travaillent avec nous. Après
Okay.
nous on a encore des autres techniciens.
Oui.
Par exemple, nous on a une fille qui spécialise juste dans figure facial.
Yes.
Et pour nous, il pas juste nous venir, nous attaquer aux figures.
Oui.
Nous avons une machine qui nous diagnose quoi que spécifiquement qui est le problème. Par exemple, moi, j'ai beaucoup de pigmentation, mon travail plus là.
Okay.
Et l'autre dit, si j'ai un bouton. Voilà, nos services, ils varient,
Yeah.
mais seulement spécifiques spécifique. N'a pas des
Okay,
gens qui
customized,
parlent.
ça veut dire,
Yes, yes.
Okay.
Everybody is different et nous besoin traiter chaque client différemment.
I've got an interesting question. A gentleman would like to know what are some of the services on offer for the guys? Because we're talking about the ladies. What about the guys? What are some of the options on the table for them?
Well, one of your first questions was if I was happy to work with ladies.
Yes.
Before, 100% of patients coming to us, they were ladies.
Okay.
And nowadays, I told you, 10% of men, they are coming to us as well.
Okay.
So we are working more and more with men.
Okay.
For the best treatment for men, they are Botox,
Okay.
peelings,
Okay.
and you will be surprised, but we are getting more as well, a lot of clients or patients that are interested on the sexual functions,
Okay.
both male and female.
All right.
So this is an area as well that we work. We want to enhance as well this health area.
Okay, because yes, we all know because with certain medical conditions, it does become available. Now, what about in terms of, we've talked about tummy tuck for the ladies. What about the men? Because we see a lot of the men, some insatials, do have a bit of a, what we call a beer belly. Mm-hmm. What is this something that can be treated in your services?
Definitely. For men,
Okay.
we have similar services like we have for women.
Okay.
For men, for example, we'll do liposuction. And something that is very common for men as well is breast enlargement.
Okay.
So this is a concern, an important concern for men.
Yeah.
Because nowadays we are showing off more our bodies.
Yeah.
We want to look better, stronger, but the breasts sometimes they get enlarged because of the age and the fat, and we can work on it as well. We do liposuction sometimes. We do just small surgical procedures, and we reshape the breast as well.
I like how you mentioned breast reduction because a lot of ladies, most of the time, we tend to go into enlargement of the breast. However, for those ladies that are suffering with back pains, etc., that comes with large breasts, can something be done for them, doctor?
Definitely.
Okay.
And I have done it here in Seychelles already.
Yes. Because we're kind of gifted, the Seychelles ladies, huh?
Yeah, but it can be a problem as well. When they are too
Yes.
heavy, this heaviness of the breast will cause a problem with the posture, back pain, as you mentioned before.
Yeah.
The bra line is going to be as well.
Yeah.
So
there is that possibility to reduce it in size.
Yes, and I have done it here already.
Okay.
So we have till now happy patients.
Yeah.
So it is important to
And it does
people
improve
know.
the health life of that person.
Definitely, you will be more confident. I have a patient that she has never, since she was a teenager, she has never been to the beach.
Okay.
Because she didn't want to show her breast.
Okay.
And now she goes to the beach. She shows herself off. So it is important.
Yes, it is.
People gain confidence.
Ok, mesdames et messieurs, voilà, aujourd'hui bon matin, nous faisons une conversation avec Dr. LICEA. Et ou, of course, si on n'a aucune question, Penny, si on n'a aucune question, aucune consultation, of course, si on a du monde, peut-être dire more l'information importante pour faire une conversation avec ou surgeon, avant là, on peut décider pour prendre, c'est a major decision, isn't it?
Yes.
Si tout le monde cette procédure qui nous peut causer là. Consultation, how does that go?
Nous cliniques ouvertes lundi jusqu'à samedi, tous les jours, 9h jusqu'à 5h. Et nous avons un docteur qui a consulté, nous avons un technicien, l'information, nous aussi le Facebook, le réseau média social. So, anytime vous êtes capable de call or walk-in, nous la assister.
Et même si un client n'a pas encore peut-être décidé s'il veut venir, c'est peut-être qu'on connaît qui vraiment a envie, mais il sentit pareil dit, pour son well-being, there is a necessity to do something. Et avant l'air, je prends une décision, whether je faire un tummy tuck ou whether je faire mon breast enlargement, breast lift, moi bien faire une conversation avec le docteur. How often que mon cas agresse sa possibilité pour faire sa conversation avec lui?
Par exemple, à part que le docteur LICEA, nous aussi on a les autres docteurs.
Okay.
Mais seulement 3 cas clients qui viennent contre nous autres demandent docteur LICEA.
Yes.
Et il aussi online, même s'il pas là tout l'année, il vient 4 fois, 5 fois par l'année.
Okay.
Et nous avons une consultation avec lui. Nous sommes capables de demander des questions, il peut répondre aux autres, faire vidéo call, nous faire portrait avant, après pour voir la différence. Mais Sylvie, pas tout service qui nous fait qui est invasif.
Okay.
Il y en a qui n'ont pas besoin de faire l'opération.
Okay.
Il y en a différents. Pour nous, il est important qu'ils viennent et ils discutent.
Yeah.
Même un phone call, ou bien un contact avec le docteur LICEA, ou bien les autres techniciens qui sont on board, nous sommes capables de guider.
Donc voilà, mesdames et messieurs, aujourd'hui, bon matin, nous faisons une conversation avec Victoria Aesthetic Clinic, basé, Miss Penny?
Beletang, Montfleury, juste opposite l'hôpital.
Juste opposite l'hôpital Victoria, c'est ça l'endroit que tu es capable, of course, passer pour gagner une conversation. Et pareil, Miss Penny dit, il y en a d'autres pages Facebook, il y en a d'autres numéros de téléphone, ou capable de call, book tes consultations, et of course, you can have that serious conversation about what you want to do. And je connais beaucoup de PTP imaginer qui sont capables d'ajouter le mot la liste. What about cosmetics? Permanent cosmetics, doctor, have you started that? Or
we do already.
You do already?
Mm-hmm. Yes, the main procedure are Botox, fillers, peelings, as I mentioned before.
Yeah. But what about permanent makeups? Do you do that as well?
No.
No.
We don't do that.
You don't do that. Lip fillers?
Lip fillers, yes.
It
is more natural. I do not recommend those kind of ink to be injected on the skin.
Oh, good question. Why?
Because it's a chemical, and it takes long to be destroyed by the body.
Okay.
And the problem is that we don't know yet how long it will affect your body later. And there is some papers already coming that this type of ink, they can trigger your immune system response.
Okay.
And you can develop immune system diseases later.
Okay.
So it's not clear yet.
All right. Voilà, mesdames et messieurs. So, nous prenons cette décision. Il est important pour nous dire, faire conversation, nous gagnons l'opinion. Et voilà, que toi, si avec, pour capable prendre une décision. How busy are you guys? Obviously, on a, par exemple, pour booker appointment, combien est-ce qu'ils espèrent payer de temps? Ou sinon, avant d'être capable de faire procédure, Miss Penny?
Nous préférons nous booker, nous connaissons dans notre slot, que les autres appointements, à cause nous vraiment busy. Surtout dans mardi, jeudi. Ça déjà, il parlait depuis bon matin, quand 5 heures, on a délai.
OK.
Mais nous préférons lundi, vendredi, nous mettre une consultation.
Yes.
Et là, au venu, ou connaît qu'elle est au venu. Pas besoin de 6 espèces et quand c'est l'état.
All right.
Yes.
C'est voilà, c'est important pour nous faire la conversation. Obviously, ou capable, par exemple, dire plus bonnet, call, gagner l'état pour faire consultation. Doctor, any advice for the ladies or gents out there listening to us and perhaps wondering, am I the next person to consider fillers for my face because of the wrinkles? Your thoughts on that?
Definitely, I advise.
Okay.
I do fillers myself.
Okay. Do you do it on yourself? Or?
Of course. I am 57.
Oh.
I do Botox on myself as well.
Yes.
And I would not recommend something that I don't do for myself.
Exactly. So
and
you practice it on yourself first?
Yes. And, well, not exactly practicing, but I get it done. And it's not only about fillers and Botox.
Yes.
It's as well about the general wellness. Okay. Because now the lifespan has increased, so we live longer.
Yeah.
But it doesn't mean that we live better.
Yeah.
We don't want to spend our last years lying on the bed. So it is important as well to change some habits, to do something, to engage on wellness programs.
Yeah.
To do early diagnosis of diseases.
Okay.
To treat properly some diseases.
Now, I'm happy that you brought that in, even though we're about to terminate our conversation. But let's talk about breast cancer patients. Of course, we have where they remove the breast. Are there possibilities for these ladies to get something back for themselves? Is
Definitely.
there a possibility for that? Would you, is it something to consider?
Definitely.
Okay.
And it is done all over the world.
Okay.
After the patient get the breast removed,
okay,
there's other treatment that can be done.
Okay.
Mainly surgeries,
okay,
surgicals, because we can reshape the breast, we can do implants. Sometimes we use muscle or skin from another part of the body just to give a natural shape. So when she dresses and when she's naked, she feels more comfortable. Definitely something can be done.
Okay. Voilà.
And we can do it.
And it can be done. Voilà. Dr. LICEA explique-nous, il dit nous bien, il y a une bonne possibilité pour explorer. Scarring as well, doctor, removal of scars. Accidents happen and certain people have scars, or ladies we've played when we were little and we've got scars which we're not thinking about, but then when we turn 20s or 15 or in our teenagers and we're looking at the scars and we want them removed, can they be removed as well?
They can be removed, and as well there are other treatments that not necessarily they are surgical, but we can work on scars to get them fade a bit.
Okay.
We can work
tattoo
on that.
removals?
It can be done. It can be done.
Yes.
Though we don't have that technology yet here, but we will get there. But
All right.
it can be done
it can
safely.
Be done. Okay. Voilà, mesdames et messieurs. Hair implants, doctor. I'm thinking, because questions are coming out the top of my head now. Hair implants? Something to consider for the future, or?
I do hair implants back in Spain. I have because I have a clinic hair institute, so we do the hair implants there. Technically, it's very demanding.
Yes.
And I will need 2 technicians. So, not now, not at the moment. Maybe
for the near future.
Probably.
But, okay, something to consider. Yes, Miss Penny. Anything you, Miss Penny, check out to have a wrap up the conversation ici aujourd'hui bon matin?
Vous connaissez, Sylvie, une quantité du monde, Cécile. Il y a overseas pour faire ça, traitement, pour les autres tout seuls, les dépenses. Ticket, avion, l'hôtel et tout ça. Et là, nous voyons possibilité d'emmener ça un service. Ici, c'est celle pour nous autres. Et bien sûr, ils viennent avec un coût, mais il y en a une façon de faire, repayment plan, regarde exactement. Et puis, donne-nous le temps pour planer les cours. Et là, par là, nous faisons comment cela est. Beaucoup de monde parle de résolution l'année qui a envie de faire, well-being, la santé. Connaître la santé est important, ou pas qu'à payer ça. So, pour nous, il est important, nous commençons bonheur, nous sommes capables de faire ce service et faire les autres plus happy.
Start the year with a big bang, as we say, depending on what type of big bang you want, whether it's for the ladies, you want to have your breast augmentation or reduction in the sense of well-being for certain ladies. Waistline, doctor. How good are we with this one?
Very good.
Shaping, body shaping.
We have surgical, non-surgical methods.
Okay.
So we have some machines that are very nice for body contouring that we can do nicely on sessions.
Yeah.
We have as well some fat dissolving injections that they can be safely applied, for instance, every 2 weeks till we dissolve some fat accumulation.
Okay.
We have as well a liposuction, laser-assisted liposuction. It's a very safe procedure. We can remove a lot of fat and improve the body contour.
Okay.
And as well, then sometimes we have to go to tummy tuck.
Okay. And tummy tuck is the last
resort.
Last resort. Okay. And even if there's, I know a lot of ladies after childbirth, they've received scarrings. How can this be removed as well?
Yes. When we do tummy tuck, we remove all that damaged skin.
And then you have a nice little line. Okay, I like how it's very slim. That's it. Mesdames et messieurs, this is our conversation bon matin. Wellness starts not just mentally, but also in the external as well. And if you look good, you feel good. And if you feel good, everything works well. Miss Penny, thank you for coming aujourd'hui bon matin. It's an absolute pleasure.
Thank you.
Merci for having you. Dr. LICEA, thank you for coming and explaining to us all the procedures that is available. And all the best to you and your team.
Thank you very much.
It was an absolute pleasure meeting you. Mesdames et messieurs, aujourd'hui bon matin, nous donnons une possibilité pour vous regarder. Est-ce qu'il y a une sabane madame qui a envie de feel good et look good? Est-ce qu'il y a une sabane monsieur qui senti qui aussi pareil ou partner ou envie de look good, feel good? Pourquoi pas? It could be a couple's goal. Tout ça là est une bonne option qui fait un petit peu plus meilleur. Et pareil nous dit, tout quelque chose de la vie avancée, si nous look good and feel good. On this note, mesdames et messieurs, ça c'était le Topik Conversasyon. Aujourd'hui, bon matin.